slight adhesion here. Basically, the fascia is a little bit congealed. It's a little bit swollen. We're going to unswell it, but the first thing I want to do is stretch you out, because this is the best thing for lower back pain. This also is good for sciatica. Issues with sciatica. Basically, you want to get the thoracolumbar aponeurosis completely loose, and right now she's stuck right here. Okay. So what I'm going to do is I'm going to push my knee out. I'm going to lean in. Hold on. Relax for a second. Let me get in position. I'm going to get my knee close to her knee. I'm sitting at a slight angle. I'm going to drop her arm over my left thigh. Okay. I'm going to push her hand up. Now hold on to your head. She's going to stabilize her neck, so basically their head stays in the same position.
I can't do that with that arm. Oh.
Which arm?
But it starts to hurt right here.
Oh, right
so
here?
Yeah.
What have you been doing with your arm again, Kelly?
I haven't been playing tennis.
Yeah, well, let's see. Let's get your arm a little looser. All right. All right, in order to be able to do this, we're first going to loosen up her arm a little bit. Lean forward into the chair. Okay. Say when. One of these days I got to take a video along and find out what my clients do in the weeks in between when I don't see them. The days in between when I don't see them. Okay, inhale, expand your bicep. Exhale, let all the energy out of it. Let it get nice and soft. By doing this, I can lift her elbow a little higher. Exhale again. Release a little more. Inhale again, and release a little more. All right, now what I want you to do is reach down and try to touch the floor. Okay, one more deep breath. Relax. Drop your arm. You've been doing, but definitely we're going to have to work this arm again. But do you think you can hold your arm over your so we can do the video?
We'll see.
All right, sit up. You've got blood flow in here now, I can tell. So reach up. How's it feel now?
Okay.
It's okay?
But it doesn't have the weight of my head on it yet.
All right, well, let's see. All right, so she's going to lean over my left leg.
Yeah.
Much better? Okay. Take a deep breath. Exhale, drop down a little more. Now I'm twisting with her. I'm actually dropping my weight down by spreading my knees. I'm pushing my knees apart to separate my hip. Okay, take another deep breath.
I already did.
Exhale. Drop it down a little more. Okay. Now I'm pushing on her hip to get it down into the chair a little more. You doing okay? Okay. Barely, you can tell. All right, we'll start from here. What I want you to do is push up just half your strength. Okay, don't use a lot of strength. Deep breaths. Keep expanding your hip here. Okay, this actually loosens up the quadratus lumborum, the obliques, and most importantly, really, it takes care of the erector spinae muscles. Okay, now inhale, come up. The minute you feel a client starting to struggle, that's when you bring them up. Oh boy, brought that adhesion right up to the surface. There it is, you feel it? Sometimes you won't find adhesions until you get rid of the swelling. The easiest way to get rid of the swelling is to stretch them out. And that's what we just did. And right now she's got an adhesion sitting right here. But she's also come loose here. Because of that, this isn't going to last very long. Doing okay? Kelly, you are such a character. That's what I love about you. Ready to try that one more time? Over. Hold on to your head. Keep your neck stable. Drop down over my left leg. Okay, take a deep breath. Exhale and drop down a little more. I'm actually bending her over my knee. Keep going. Every exhale is another deflation. She's deflating her whole upper body. Stretching out the muscles. Okay, ready? Inhale. inhale, expand your body and push up like you're trying to sit up again. Forward in the chair. And I'm just going to do a quick massage here to do the other side after the video, basically just to keep this reasonably short. 5 minutes? Okay.
5 minutes.
All right. So essentially now that I've loosened her up, I can feel for the adhesions. This one's already broken up. She's got a remnant. Basically what an adhesion is when two muscle fibers get stuck together because the fascia in between them is dehydrated. In other words, she hasn't been getting enough blood flow into this area. So we're going to take care of that now. We're only going to do one side for the sake of the video, for the sake of brevity. But then I'm going to take care of her afterwards because you don't want to leave the client lopsided. Okay. All right, now what I want you to do is sit up. Now give me your right hand over your left shoulder. Just reach it over. No, not on top. Not on top. Cross, drop your shoulder, relax your whole arm. Fall asleep. Drop the shoulder. All right. Now I want you to turn all the way to your left. Push back a little bit. All right. Now, right now, I'm actually working on these adhesions, these remnants of adhesions. I'm going to push a little more blood into them, and I'm also going to stretch out the fascia. Once the fascia is already pre-stretched, like it is now, it's much easier to work with. Basically, the fascia can't do two things at once. Okay, now what I want you to do is turn all the way to your right, twist all the way to your right. I'm twisting in the opposite direction. She's twisting to her right, I'm twisting to my left, and I'm pushing into her hip here to get the fascia loose. This is incredibly effective at getting rid of adhesions. And you could use this with different tools. You could even use a T-bar. In my right hand, I could actually use 2 T-bars. I needed to, but I prefer to use my fingers. Okay, take a deep breath. Exhale and relax. Got to give the client a break once in a while. All right. Now her whole back is soft. Her whole lower back is soft. This is great for lower back pain. The problem is people compress their sacrums. And think about it, I mean, what we call good posture is not good posture. The idea is that everybody thinks, you know, if you're standing up straight like this, or sitting up straight, that's good posture. It's not. What you're supposed to be doing is separating all the vertebrae. In other words, you push the crown point up and stretch your spine out, because what we're doing all the time, even with what we call good posture, we're just lining up all the vertebrae over the lumbars. Lumbars are going to get all that pressure, all the weight from here, all the way down here, and this gets all compressed. And then the muscles start to tighten around them because the fascia doesn't get enough blood flow. And then it stiffens and hardens like Elmer's glue. So you end up with adhesions. Adhesions are muscle fibers sticking together. What you have to do is pull those apart. And this is the easy way to do it. Okay, give me your right hand again over your left shoulder. That's it. Drop the arm. Pretend your arm is falling off of your shoulder. Just let it relax. Okay? No need to get a lot of tension up here. So I'm going to dig into her pelvis again, right about here where I felt the adhesion. Turn all the way to your left. Okay, now turn all the way to your right. Try to turn your thumb up to the ceiling. There you go. By doing this, she's stretching out her latissimus dorsi, but she's also pulling on the fascia down here. The thoracolumbar aponeurosis is coming loose. That's really important. You can even see it. I mean, that's a good glide. I get really good glide here. Okay, deep breath. Exhale and relax. Drop your arm. Lie forward again. Okay. All right, so basically, at this point, 2 techniques I'll use on the back. I'm just basically scrunching up her fascia from her shoulder. It's always opposite shoulder to opposite hip. So I'm pushing up on one hip and pulling down with the on the other shoulder. And what that does basically, this is kind of a push and release thing where the fascia will come loose this way. Then what I'll do is I'll reverse my hands and I'll push out on the side here. This pushes the erector spinae muscles out away from the spine, and that creates a whole lot more circulation. It pushes more blood into the area. So our back is really loose now. And Kelly, I'm proud of you. You really worked for this because your back is loose. You should be feeling pretty good. Why don't you sit up, stand up, walk around a little bit. See, kick your right leg out a little bit. See how it feels.
Okay,
Help?
yeah, I just need help.
What are you laughing for?
Oh, man, I have too much fun in this class.
Feels good?
Feels good.
Yeah.
No more pain?
Yeah. Yeah.
All right, so basically that's what we're dealing with. It's trying, in lower back techniques, I've seen so many techniques and so many of them just don't work. This one works. There are others that I use, there are other things that I'll mix in with this. It depends on where the adhesions are. But the important thing basically is to get the quadratus lumborum and the rectus spinae muscles stretched out. Okay. So where are we at?